TV. This program is supported by an educational grant from the following companies. Tonight's topic is part one of a series, Taking Control of Your Diabetes, Education, Motivation, and Self-Advocacy with Dr. Stephen Edelman, MD.
I was born in 1955 and pretty much grew up in California, in the San Fernando Valley. I developed diabetes at the age of 15. During the first few months, I didn't really realize that something was wrong. I started to develop excessive thirst and urination and being just unusually tired. I lost about 20 pounds, and I remember this one scab on my knee, which would not heal. The doctor whose turn it was to take care of me was not a diabetes specialist, and he was the one that took care of my diabetes for the next 7 to 8 years. No one had really taken me by the shoulders and shook me and said, hey, high blood sugars causes damage to your body. All of my urine tests were abnormally high. My doctor, he didn't seem to care. The procedure was always the same. He'd call me in his office, and he'd come in his little clipboard, and he would look at the results, and he'd say the same thing to me every time. Steve, you're doing fine. I'll see you next time. One time, I decided to test him. So before my visit in the morning, I went to a place called Winchell's Donuts. And I still remember eating 5 donuts. And I went to the doctor, I gave my blood, and I gave my urine sample, and I tested my own urine at the time with one of these urine strips. And I remember that it turned black in about 2 seconds. My blood sugars were through the roof. So he comes in, he's looking at my results from that morning, and he looks me straight in the eye and says, Steve, you're doing fine. I'll see you next time. I realized that he didn't know what he was doing, and I never went back to see him again. I was interested. I was ready to be educated. It's got to be one reason why I went into the field of diabetes. I went on an insulin pump my last year of medical school in 1982. As I look back, I still remember a lecture on pathology saying that 50% of all juvenile onset diabetics are dead 20 years after the diagnosis from kidney disease. Here I was 8 years after the diagnosis thinking I got 12 years left. In 1985, I was encouraged to extend my training at the Joslin Diabetes Center in Boston, where I was becoming an endocrine fellow. I met my wife-to-be, Ingrid, who happens to be a diabetes foot specialist. She was getting her training there at the same time.
When we first got married, he had sort of the attitude that he would not live very long. And even when we had Talia, he did not want to start any retirement plans.
My daughters, I do try to implant memories of them being with me. Now that I have kids, I say to myself, gee, I want to be around for them when they get older. And I want to be around to be a grandfather. Hello, my name is Steve Edelman, and welcome to the premiere of Taking Control of Your Diabetes. I am not only a physician specializing in diabetes, but I've also been living with diabetes since 1970, diagnosed when I was 15 years old. Taking Control of Your Diabetes is a not-for-profit organization whose mission is to promote education, motivation, and self-advocacy to people living with diabetes, their loved ones, and anyone interested in this increasingly common condition. Why do we need organizations like Taking Control of Your Diabetes? In 1993, the results of one of the most important diabetes studies ever conducted, the Diabetes Control and Complications Trial, were announced, confirming what many researchers, including myself, had suspected for a long time. Working hard to keep the blood sugar levels to as close to normal as possible will dramatically reduce those horrible complications we hear about, the incidence of blindness, kidney failure, amputations, and heart disease. These classic complications of diabetes not only reduce the quality of life for people with diabetes, but also cause so much emotional pain and concern for their loved ones, not to mention the drain on the healthcare dollar. Soon after this landmark study was completed, which set the medical standard of care not only in the United States but also around the world, I realized that this information was not being translated fast enough into appropriate diabetes care at the community level. At that time in 1995, I felt strongly that one of the most important missing links to diabetes care was that there was not enough information about living a healthy and productive life with diabetes directed to the people most affected by this condition. And that was the beginning of taking control of your diabetes. While it is always important to continue to educate the caregivers of this country about how to take care of people with diabetes, I also feel very strongly that we should educate and motivate the people living with diabetes in a parallel fashion. This will promote better communication and exchange of information, not only between the caregiver and the patient, but also the patient and the caregiver. Over the past 11 years, Taking Control of Your Diabetes has focused on our mission of education, motivation, and self-advocacy by producing over 70 large conferences and health fairs at major convention centers in cities around the United States. There is a lot written about diabetes on the internet and other sources. However, I feel there is no substitute for the face-to-face interactions that occurs at a conference such as Taking Control of Your Diabetes in order to help people live more healthier and more productive lives. A little squirt with each meal.
Taking Control of Your Diabetes is a patient conference and health fair that is making living with diabetes just a little bit easier for people all over the country. Taking Control of Your Diabetes, or TCOYD, offers a full day of seminars, workshops, and one-on-one counseling to help people more easily cope with diabetes on a day-to-day basis and long into the future. For less than the cost of the average copay, patients have the opportunity to meet face-to-face with doctors, podiatrists, psychologists, nutritionists, and even legal and insurance experts.
Just one day where I can come and give myself some time to help take care of myself.
Go speak to the pediatric endocrinologist here in the afternoon.
People should realize how important it is to have access to excellent doctors and good information.
I want to learn how to treat diabetes and how to deal with it. There's a lot of people that are getting tremendous benefits from attending these seminars.
The first one I came to, it completely changed my life. It changed my family's life.
If left uncontrolled, diabetes can have deadly consequences. People with diabetes are 2 to 4 times more likely than others to develop heart disease or to have a stroke. They're also 3 times more likely to die of complications from flu or pneumonia. And many suffer nervous system damage and poor circulation, which can lead to amputations of toes, feet, and entire legs. TCOYD also showcases the latest treatment options with 35 to 60 informational booths, offering ample opportunity for direct conversation with manufacturers of diabetes medications and supplies.
Living with diabetes can be especially difficult if you do not have the knowledge on how to deal with the day-to-day challenges. Someone with diabetes must think about so many different things during an average day that most people without a chronic condition take for granted. Taking medications at scheduled times, eating different types and amounts of foods at different times, figuring in the duration, intensity, and types of different exercises, testing the blood sugar levels with a little glucose meter several times throughout the day, and interpreting those numbers. These are just some of the factors that will affect a person's diabetes each day, and that is in addition to the effects of stress and other illnesses that someone may have. This is why it is so important that everyone with diabetes become the most active member of their healthcare team. It is not enough to become merely knowledgeable about the various areas of diabetes, but one must also be motivated to take action in terms of self-care management in order to achieve and maintain the goals of glycemic control and other therapeutic goals that you may have living with diabetes. The TCOID